spoiler alert, no Sue Gray or Met, I'm going to mention throughout the course of this interview.
What?
I know, can you believe it? Let's start with the NHS backlog instead. Your plan, well, the booking a treatment on an app. How does that work?
Yeah, so because of COVID, the NHS rightly focused on COVID patients, and it has meant, sadly, that the waiting list has risen significantly. And I have to tell you, I think the waiting list is going to continue to rise for a while until it starts to fall. And the reason...
To what?
We can't be sure. And the reason is because we estimate about 8 to 9 million people stayed away from the NHS because they were asked to. They did the right thing. But we want them to come back. I want them all to come back because I want them to know the NHS is there, it's open for them. But as they do, of course, that's going to create more pressure. And my job, the NHS's job, is to get through that elective backlog, that COVID backlog, as quickly as we can. And what we're announcing today is that part of that plan will include a new online service. It's called My Planned Care. And it will mean that every individual on the waiting list in England will be able to see online exactly where they are on the waiting list, what the average wait is in their area, and other information about how they can prepare for their treatment. The importance of this is that, understandably, many people will be anxious and stressful, about their position on the waiting list. It's perfectly understandable, and we want to provide as much transparency as possible. Of course, alongside this, there's lots else going on. We're investing a record billions of pounds in the NHS to get through that COVID backlog, including investment, for example, in things like the new community diagnostic centres. Already, they've done some 400,000 extra diagnostics. They'll do an extra 4.5 million by 2025. So there's a lot of investment going in. I just want to make sure that we're doing everything we can to help people with their health and care, no matter where they live or who they are.
And I thought for the families of those that didn't make it because they were waiting and sadly they've succumbed to their illness.
Well, sadly, of course, that it's happened. I talked about that, of course, just on Friday when I launched a new call for evidence for a new cancer plan. I want to do a new 10-year cancer plan. But when I talked about that and just preparing for that, we think there's at least around 50,000 people when it comes to cancer that sadly didn't come forward. They haven't come forward because of COVID. And in some cases, there's been devastating consequences.
And a thought for the families, what would you say to them?
Well, I think that, of course, my heart goes out to anyone that's been affected by that, and their families, their loved ones, their friends. And I would just want to reassure people that inside government, working with our friends in the NHS, we're doing everything we can to get services back up and running, getting them back to normal. Unfortunately, because of the Omicron variant, which we've all now obviously all know about just in the last few weeks, that's had another impact as well. But we're getting on with this, and we will also shortly be publishing a very ambitious, full elective recovery plan.
OK. I was reading in my Telegraph newspaper this morning that the NHS backlog plan is not coming today because you've hit a roadblock with the Treasury.
Well, it's not coming today because we had a roadblock with Omicron. I had actually planned to publish the plan in December, and we were almost there. We're agreeing it finally with the NHS and across government. But because of Omicron, we've rightly changed our focus, especially to boosters and to focus on that. And we obviously did the right thing. It makes us now the freest country in Europe, and we're heading the other side of Omicron.
Okay.
But we will publish the plan shortly.
The reason I ask that is because Matthew Taylor, who you know, who is the NHS Confederation, has said on Twitter, increasingly getting the sense that Johnson now faces the same but more intense and short-term challenge that Tony Blair had in his third term. We've got this graphic, I think. Normally, HM Treasury is loath to agree to any number 10 plans involving money and the Chancellor. So, yeah, what do you think? So they're suggesting that it's the Treasury that's the problem.
In fact, what I would say about the Treasury is that I couldn't wish for a better partner when it comes to the challenges that I have.
So this is wrong?
I don't recognise that at all, because actually I can tell you personally from having been Chancellor, having a close relationship with the Treasury, having a strong partnership for any department is crucial. And right now for health and care, I'm just really pleased we've got that really good working relationship. You
talked about the NHS backlog getting worse before it gets better. When is it going to get better?
It's hard to know because of the people that have stayed away. It's really hard to put a number on that. And I've asked that question myself, of course, of our friends in the NHS, and they will rightly will come back to me and say, look, a lot of it depends on how many people come back? You know, what's of those people that stayed away, the 8 to 9 million, what proportion of them, you know, come back to the NHS? And as I said, and I can't be clear, and I would like to say this if I can, just make clear to your viewers that if you're one of those people that, you know, for whatever reason you weren't feeling well and you stayed away from the NHS because you were told to, because you did the right thing during the pandemic, you know, please come forward, and the NHS is there. But it will, of course, mean that the NHS will have to, you know, rightly deal with that, find the investments and you know, the procedures to deal with that. But the record amount that we're putting into the NHS, that's an extra 2 billion went in this year just for elective procedures, another 8 billion over the next 3 years. That's going to pay for something like at least an additional 9 million more scans and tests and procedures, and we'll be able to deal with many, many more people.
Is there not going to be an extra 12 billion a year into the national health and social care, given that that's how much the national insurance is?
Yes, I'm just referring to the money that's ring-fenced for elective care. Of course, the NHS does a lot more than that.
OK. Is the money that is from the national insurance increase, all of that money is going to the NHS and social care, not going anywhere else?
The levy is all NHS and social care.
Forever?
It's health and social care. It's broadly health and social care. So it includes, for example, spending on vaccines.
But it won't be hived off anywhere else.
It's a health and social care levy.
Because I heard one of your colleagues at the weekend saying, for now.
It's a health and social care levy. The Treasury's been very clear about that.
OK. Let's move on, should we, and talk about Jimmy Savile. The row over Jimmy Savile has caused all sorts of problems. The slur against Keir Starmer. In fact, one member of the Downing Street team resigned, she says, as a direct result of that. Should the Prime Minister apologise to the Labour leader?
Look, first of all, I understand the sensitivities around this. And this is why the Prime Minister himself, after he said what he said in Parliament, has clarified his remarks. And really, I think that's all there is to this now. And I think we just try to move on from this. There's so much else that is going on. And I think that we should draw a line under this issue and just try to move on, because the Prime Minister has come forward and clarified his remarks.
Let's just remind our viewers what he actually said in the House of Commons.
This leader of the opposition, a former Director of Public Prosecutions, Mr. Speaker, he spent most of his time prosecuting journalists and failing to prosecute Jimmy Savile.
Outrageous.
Well, I don't know if you've got the other clip, which was, I think, a couple of days later, where the Prime Minister did clarify his remarks.
He clarified, he didn't apologise, and it's a slur.
It's important that he rightly set out what he meant. It doesn't. It's not. You know, I wasn't there responding to the report. So the Prime Minister has said what he wanted to say, and subsequently he's come forward and clarified those remarks.
Okay,
and that's
this is what Rishi Sunak said. Can we listen to that? Here we go.
Being honest, I wouldn't have said it, and I'm glad that the Prime Minister clarified what he meant.
So he's happy to say that he shouldn't have said it?
He's also pleased the Prime Minister clarified the remarks. I don't know, do you want to play the clip of the Prime Minister clarifying the remarks? Have we got that? Can we play that, please?
I think you're fine. It's my show.
All right. So it's interesting you're not showing that.
What we have got is you.
Keir Starmer, when he was running the DPP, did a good job, and he should be respected for it. It's a tough job, and he deserves absolute respect.
Getting a bit testy about this. Why are you so testy about it?
I'm not. I'm just saying that of course, it is a sensitive issue. I get that, and that is why
Savile's victims are furious.
That is why the Prime Minister rightly, I think it was just a couple of days later, made it clear what he meant and also what he didn't mean. He came and said that, and that was right. And right now, hopefully you'll understand, your views on this isn't the issue that I'm focused on. I'm focused on my work at the department, which could not be more important. We've talked about the NHS, we've talked about electives, we've talked about COVID, quite a lot. Social care.
But one member of staff who had been loyal to the Prime Minister for 10 years, she stepped down because of the fact that he wouldn't apologise, even though she told him to. We heard what Rishi Sunak said. He says he wouldn't say it. You have said, as we illustrated there as well, that, Keir Starmer has your support. Why will this Prime Minister not apologise when it's blatantly obvious sometimes that he just should?
Well, look, I can't add anything more than I've already said. He's clarified the remarks, and I think it's the right thing to do. And I think hopefully we can draw a line under this, because he's been really clear about what he meant and what he did not mean. Okay. And that I think was really important.
OK, would you have said it?
It's not about me. It's not about me.
You.
No, it's not.
You're sat here in front of me now. I'm asking you, would you have said it?
No, it's not about me. I'm not the one there responding to the report.
Okay.
You know, I'm responsible for what I say, and I think I've been very clear about
So
this.
Mr Sunak was wrong to say what he said then?
You have to get Mr Sunak in and ask him.
Well, try every week. What can I tell you?
Keep trying.
Yeah, I will. Downing Street has been described as dysfunctional and needing a shake-up. Dysfunctional and needing a shake-up. How would you describe Downing Street over the last 2 years?
Well, we've achieved as a government, and obviously Downing Street at the heart of that, a lot has been achieved. I mean, Downing Street, if you want to call it that, or government more broadly, we have protected this country from Corbynism. We've delivered on Brexit. No, was it dysfunctional? No, it's not something I would have recognised. But when my own work with Downing Street would have been quite limited. But the changes that are now being made is what the Prime Minister, he had promised this in response to the update from Sue Gray, where Sue Gray herself, I don't remember the exact words in her recent report, but she had talked about the fragmented relationship, for example, between the Cabinet Office.
Said lots of other stuff as well.
She said lots of stuff. But in terms of Downing Street, she talked about the fragmented relationship between the Cabinet Office and Downing Street and the need to make changes. So I think the changes that the Prime Minister's announced, in particular the appointment of Steve Barclay, a very strong individual, very capable.
That is, so it's not.
But it's someone. It's someone
that means
who.
Nothing to my view.
But it is someone who understands the Cabinet Office.
He's got
and now having that
well,
link with Downing Street now will
I'm not
be crucial.
I'm not going down that rabbit hole. What I am going to say is reports say the Prime Minister has told his allies that critics will need a tank division to oust him from number 10. It's an honour to serve. It's not a birthright.
Of course it's an honour. It's an honour to serve as any minister. Well, it doesn't, just because someone said that doesn't mean
you can hear him saying it.
Well, I've never heard that, so this is just some speculation in the press. You shouldn't believe everything you read in the press, Kay.
Well, I don't. I don't also believe everything that politicians tell me either.
Well.
Moving on. Carrie Johnson was your special advisor when you were business secretary. You've seen the comments about her in the book by Lord Ashcroft at the weekend. Is this misogyny? Pure and simple.
Yes, it is. It's sexist. I mean, it's why. First of all, I think the partners of politicians should be off limits. There's no. Why would you go after or attack the partners of politicians? And by all means, go after the politicians. But why their wives, their husbands, or their partners? And
because they encourage them to break lockdown rules, I suppose.
Well, no, this is not what this is about. This is just about going after an individual. I actually do think there's a sexism involved in this.
That's right.
And, I mean, I really do. I do think this, and I just think doing this, going after, in this case, you're going after Carrie Johnson it's undignified, it's unfair, and it's just wrong.
This is her statement. Actually, she's put out a statement on her behalf. Here we go. Yet again, Mrs Johnson has been targeted by a brutal briefing campaign against her by enemies of her husband. This is just the latest attempt by bitter ex-officials to discredit her. I suppose that's a reference also to Dominic Cummings, who's apparently going to make more revelations later on today. She is a private individual who plays no role in government. You would second that?
Yes. Well, do you think Sherry Blair played a role in government? Do you think Norman Major played a role in government?
I'll play devil's advocate because
they have no formal role in government, and so this is absolutely correct.
She was a Conservative Party. She worked in Conservative Party Central Office, I think, previously. So she was quite active within the party. Not. I'm trying to play devil's advocate. I mean, I also don't.
She was, as you say, she was my special advisor. Yeah. She was an excellent special advisor, but she's not in government in any way. She has no formal role in government, and to the extent she would have anything to discuss with her husband to do with government would be any different from anyone before her. So why is she any different to anyone that came before her as a partner of a Prime Minister?
And what would you say to Lord Ashcroft and Dominic Cummings and the like?
Well, I would just say that, if you want to talk about number 10, these issues, by all means, please do so, but, focus on the Prime Minister.
We all want to be successful in life, don't we? We all have ambitions and goals. Do you want to be a leadership contender? You're going to tell me there's no. You're going to tell me there's no vacancy.
I've been there and I've done that, and I'm just focused on my job. And I'm really, as you said, it's an honour to be in government in any role. It was an honour for me when the Prime Minister invited me to take on this job at the time that he did, in the middle of a pandemic. And that is a privilege. Every day I wake up and think of it as a privilege, and I do everything I can to help.
Can you rule out completely a leadership bid?
I don't think there's going to be a leadership election. I don't think there's going to be a leadership election because we've got a leader in place.
Can you rule out a leadership?
We've got a leader in place that's doing an excellent job. He's getting on with the job. He's delivering on all the commitments that we made, and I'm there to support him alongside the rest of the cabinet.
Can you rule out a leadership bid?
There's no leadership election.
It's good to talk to you. Thank you very much indeed for joining. I told you I wouldn't mention Sue Gray or the Met. Yeah, chalk that one down. Thank you very much. It's great to talk to you. Thanks.